What if we think about vaccines as more than a shot in the arm, but as a powerful act of community care?
COVID-19 vaccines can help save lives, but many people are still hesitant to get that jab.
Vaccine hesitancy is slowing down our chances of reaching herd immunity and returning to some kind of normalcy.
I'm Dr. J. Rutland with guest host Cris Medina, NP, and today on the Health Exchange, we're diving into the science, stories, and social impact of vaccines with Dr. Anissa Davis, City Health Officer for Long Beach, California. From navigating the COVID-19 pandemic to tackling vaccine hesitancy head-on, Dr. Davis brings both expertise and heart to the conversation. Let's get into it. Cris, thanks for being here again.
Thank you for having me.
Dr. Anissa Davis.
Hi.
Thanks so much for coming.
Thank you for having me.
You're a city health officer for Long Beach, right?
Mhm.
So what does that mean? Like, what is your day-to-day?
So the day-to-day of a health officer, we're a public health official, so we work usually in a health department. And the overall umbrella of what we do is the regulatory part of public health. So if a beach needs to be closed, that would be done under the health officer. If a foodborne illness outbreak happens in a restaurant, that would be done under a health officer. If a certain treatment isn't being done correctly, a health officer might get involved. If somebody's not taking their TB meds, we might get involved. So it's anything that's protecting the public health that has a regulatory or authority type of situation attached to it.
Obviously, I know some of your background, but tell me how you ended up where you are right now.
Well, I knew that I wanted to be of service, and I also knew that health disparities was a primary interest of mine. And I don't think I really knew what public health was, but I knew what a health disparity was. And I also knew that access to high quality healthcare was really important, and that things done on a community level, I think, is a really vital part of health. It's not just what happens in the office. That's really important too, between you and your doctor or your healthcare provider. But what we do as a community is really important. And so as I got more into like what that meant, I knew that that meant public health and medicine.
So you did your fellowship at the Long Beach City Public Health, right?
Right, under the California Department of Public Health. They're
Yeah.
the ones that do the fellowship, and they place you.
But then you finished that, and then you said, no, I'm going to go into private practice for a bit, and then I'm going to come back. Was your plan always to come back?
It was, I mean, things were open. I knew that I wanted to serve and be a part of medicine. So I knew that. I don't think I had like, it has to be this, it has to be that. Private medicine, I wanted to make sure I kept my skills up. And so you need to do it to keep your skills up. I had a new baby. And so the situation was just, the time and what have you worked out right. And then after I did it for 11 years, I was looking for leadership opportunities, and this position came up. And I think it being in Long Beach had a big part to play because it was the community where I grew up, where I graduated from high school, where I did my family medicine residency, where I have my children. Yeah. And so it was like coming home.
Kind of a full circle moment for you to grow up in Long Beach, and then you're now giving back to the community that, in essence, you were raised in. So that's pretty substantial.
Yeah. So that meant a lot.
Yeah, absolutely.
And you mentioned earlier one of your focuses is healthcare disparities. Was there a particular event when you were growing up that stands out in your mind? You remember, you're like, you know what, I want to do something about that.
The thing that stands out, I remember that African Americans had worse kidney function and had greater kidney failure and ended up on dialysis sooner than everyone else. And that, I think I was around 12. And I also remember hearing about blood pressure and how we had higher rates of blood pressure and, more difficulty maybe controlling it. I think that kind of, I would say it was a spark. I think there were a lot of different types of sparks that happened, but that one was definitely one of them. And I think just as I continued to learn more about different disparities and really what public health was, making communities safer on a large scale, whether that's, good parks and, food and healthy eating, safe neighborhoods, all of those things just really called to me.
Sure.
So how do you think your office now impacts health disparities? What strategies have you implemented in your office to help narrow that gap?
So the first thing is always data, and that's one of the cornerstones of public health is collecting data. And so that's the first way that we kind of identify disparities. And I think that what public health has also been really good at is trying to open the door into why those disparities are happening. I think that that's really important as well. To really combat a disparity, you need to know kind of all the things that led up to that that difference. So we've been very active. We have people who are working specifically in health equity at the health department and at the city. So I think that we've done a really good job of reaching out to communities, partnering with communities, listening to communities about their health issues, and then partnering with solutions. We also, another part of getting rid of disparities is really meeting the need of the individual in front of you. So if language is a barrier, meeting that need. If transportation is a barrier, meeting that need. If housing is a barrier, meeting that need. So we try to get rid of all the assumptions that you may have when you're providing healthcare, which is that somebody has a car and somebody can get there and somebody will speak whatever language you're speaking. And so we just really try to go to where they are. We try to do medicine in the field. We try to, match languages and be culturally competent.
If I'm a patient and I know that I have hypertension and diabetes, I've lost my transportation and I can't get to my doctor's appointments, is there a way to call your office to help with that? Or is that, because you mentioned transportation is one, is there a ability to do that? Or is that, no, I don't know if we can exactly help with that. Like, how does that?
So it mostly where we can intervene the most is around the communicable diseases that we are treating at the health department. So we treat folks who have HIV infection, and yes, we will give Metro cards, we may give taxi vouchers and different things around that so that you can get to your medical appointments. So we can't do it for the entire community. We'd love to. But we definitely do it for the things like tuberculosis. If you're being treated for that, we might provide housing while you're on treatment because it can be several months, and that's a big barrier to getting treatment. Transportation, we've done Uber, and we have a vehicle that we can use. So we definitely do it for in specific instances. I think another thing that it's important from public health is highlighting those needs. So we might not be able to meet all of those needs, but being able to say childcare, transportation, having better hours to help working people, advocating for people to get paid time off so that they can take their kids and themselves to the doctor. So those are things that we do in public health.
We just went through the pandemic. We had the SARS-CoV-2 pandemic affected obviously everybody in the world. And I'm sure public health officers such as yourself in their respective cities went through a lot. And I guess my question for you is, during that time, so you're going through the pandemic, how did you deal with that? Like, what was, when the pandemic first started in March of 2020 and they announced it, how did you prepare yourself? Or were you like, oh, it's probably not going to be that big of a deal, we'll just kind of write it out? Like, how did you feel during that experience?
The pandemic lasted for years, and so there was a lot of roller coaster of emotions. I probably had every single one of them. I'm sure I went through all the 5 stages of grief. I'm sure there was a time when I didn't believe this was happening, and then a time when I was really angry. And I think by the time we got to March, we knew that it was a serious situation. And I think the things that we did, one of the things about public health that's really important is partnerships. And so there's a lot of partnerships within public health. So working with the CDC, the California Department of Public Health, and then other local health departments. We had to come together to order to combat that. And then working with different external partners within the city. So schools, nursing homes, businesses, restaurants, like everybody, the hospitals. Everyone was trying to get their needs met. And things were in very short supply. So masks were in short supply, the gowns, gloves, what have you. It was a new virus. We didn't know everything about it. So there was a lot of differences around that, what to do. One of the big things I learned was communicating and having difficult conversations, because you had to be able to have really difficult conversations about just a variety of things, whether it was how many tests we could give to a certain entity, how many vaccines we could spare over here, whether we could let a cruise ship dock at our port. There was just so much going on. And so I would say that that was one of the biggest lessons learned, is that we needed to work together, and that we all have different perspectives, and there's many different ways to look at things, and being able to really listen and try to partner with people to find solutions.
When the vaccines became available during the pandemic, and we know that vaccination was such an important tactic during the pandemic to prevent severe disease, because the vaccines, at least when they first came out from a wild type standpoint, they were extremely efficacious. Right? We've never seen 90% efficacy in like any vaccine up to that point. What was your strategy for disseminating vaccines to individuals that didn't have the access, to individuals that you already knew were suffering from healthcare disparities and things? How did you overcome that?
We worked a lot. One of the main public health tenets is going to where people are. And so we did a lot of that, both with testing and with vaccinations. So churches, we went to local churches, we went to local parks, and then we had the huge, big convention center vaccine program where we could vaccinate up to 6,000 people a day. And so we used trusted messengers. We did door to door. We went to, laundromats and what have you to help with the communication.
You did door to door?
We did door to door, both in neighborhoods and then like businesses. So we had people that were actually like going into laundromats, going into barbershops. Hey, we have this program. You have some questions. It's free. We used incentives, and that was important. And when we rolled out vaccines for kids, we actually made like a whole, fun activity. So we had bubbles and music and balloons, and we had a really good time. So I think, the data showed us where the disparities were. So we made sure that we focused on those zip codes and census tracts. And we also worked with trusted messengers, like where do you think would be a good place to set up a vaccine program? And then, can you help us get the people to come?
Once you were there, people that look like me and you and Chris, was it easy? Did the people come and there was no issue? Nobody was, I don't believe in this. Like everybody it was fine. Like everything was.
So I would say in general, just for vaccine information for Long Beach, I felt like everyone was really appreciative and respectful. So everyone took the information in and seemed happy that we were there and happy that we were giving the information. They did different things with the information.
Yeah.
But I think that people were very grateful. The people who ended up agreeing and coming down, they had already made the decision. So yes, it was very easy. But we also had people there that could answer questions at the time. And during the pandemic, I think because so many people were dying, people all around us were dying, I think that was a huge incentive to bring people in. So I don't think it was as hard.
So you're talking like 2021 into early 2022.
Sometimes just with my friends and family, I was just like, hey, there's this vaccine, do you want to come? You want me to just make you an appointment? Like there wasn't a hard sell, and they'd be like, oh, okay, yes.
And Dr. Davis, what was your approach to the residents of your city that were maybe a little bit hesitant to get the vaccination? I'm sure that was challenging. I know the majority of people were willing and accepting of the vaccination, but for that population that was a little resistant, I'm sure it was a challenge for you. How did you approach that?
It was really important to take people's concerns seriously. You have to also have the long game, like maybe this exact interaction isn't going to result in them getting vaccinated, but we're planting seeds and keeping lines of communication open. And I also think it's important that we learn as well, like what are your priorities, what are your health concerns, and then partnering with people with those concerns, I think is important as well.
When you're going through all of this and in the beginning when everybody is dying around us, because again, I was an ICU attending at the time and everybody was dying. Yeah, the vaccine was an easy sell. Then when the deaths started to kind of
Mhm.
trickle down, right, and we were still suggesting to get COVID vaccinated, then everybody started questioning that. And then everybody started questioning vaccines in general, which led to a reduction in the rates of other vaccine uptake since which I just find completely ridiculous. But what do you think caused that?
I think that it has been important to highlight the decades of research that have gone in to determining and to reassuring that the vaccines, all of the vaccines that we recommend, are safe and very effective. And we need to continue that conversation. The vaccines, one of the big concerns right now is measles. We're having some epidemic number of cases within the country and within the world and within the continent, both Canada and Mexico. And it's important in the midst of that to highlight the fact that the MMR vaccine has been studied for decades on hundreds of thousands of kids in many different countries. So there's this overwhelming body of evidence that shows that it's safe and effective against a very serious and potentially deadly disease.
So, Dr. Davis, we as a population worldwide learned so much from COVID. How does your outlook now as a public health official changed post-COVID?
I felt like public health did a great job responding to the pandemic with the limited resources we had and the limited amount of information that we had, which was coming out really quickly. In bits and pieces, lots of different changes. So I felt like we were doing a very good job at the time. I think what we have learned going forward is partnering with communities and maybe refining our communication, what works better, being more community-centered, and building those relationships, I think, is really important. Those things do take resources.
Sure.
Public health funding in general has been drastically cut at the federal level. So I do think that investment is important so that we lay the framework and the groundwork for those relationships and communications and strategies, co-strategizing for when the next emerging infection comes around. And it will, because it has.
Sure.
We've seen bird flu. We're watching that really closely. And then we're seeing measles, which is running rampant right now in the continent and globally. We do have a significant outbreak in the Southwest, but we're having cases in numerous states.
What do you think those are related to? Is it lack of vaccination, or what is your opinion?
The issue with measles is that it's super contagious. Like, it's really, really highly contagious. So it's a virus that if you're not vaccinated, 90% of the people that get exposed to it will get measles. And you can actually catch measles just from somebody being in the same room. So they don't even have to be there. They can have left the room, and then for 2 more hours, if you go in that room, you can catch measles. Consider, airports,
right.
Health clinics, hospitals, emergency rooms. So it's very contagious, and because of that, we really need to have a high level of vaccination in the community for the community to be safe. So
Sure.
kind of a community immunity,
Compliance,
if you will.
yeah.
And so if you dip below like 95% or so, so that's a pretty high bar, you can have these outbreaks.
So there's an inverse relationship between receiving a vaccine and outbreak. Is that
Right.
safe to assume?
Right.
Okay.
The vast majority of people who are becoming infected are unimmunized, or they don't know their immunization status. So yes, being immunized is the best way to protect yourself from getting measles.
Sure.
The public has to have an understanding that when we're talking about pandemics, when we're talking about organisms presenting to society, these aren't new. Like, these are organisms that have been present in society for a very long time. Like, even if you look at SARS-CoV-2, SARS-CoV-1 was here in 2005. We were already studying it. We already had guessed that virus was going to be the next pandemic. And so when individuals are questioning vaccines and how fast, the things that you have to know to develop a vaccine is you have to understand the structure of an organism. you have to know what the organism looks like. So when you look under a microscope and you look at a virus has a membrane that encompasses its DNA or RNA, and then it has certain proteins on its membrane, right? The outside. When a virus presents to the immune system, your white blood cells get activated and they go to the area where the virus is present and they congregate there. And what actually happens there is they start learning about the organism, breaking it up into little pieces, recruiting more white blood cells into that area. That's what happens in these end organs. Like if you have a respiratory virus, that's what's happening in your lung. And that congestion leads to all your symptoms, right? Your shortness of breath, your inability to gas exchange, all of that. Once we learn the proteins that are involved on the virus, so if we know the proteins that are on the outside of the virus, right? If you have like this candle on the table, the proteins that are on that brown part of the candle, on the outside of it, we know the antibodies are being made that are directed at that protein to not allow that protein to attach to our cells. We know that the T cells are being made to not allow that protein to attach to our cells. So our T cells recognize that protein, preventing that bonding from taking place. Once we understand that, then we can start developing vaccines, right? We look at that protein, we make the protein ourselves, and then we modify it a little bit, or we take the whole organism and we weaken it in some way, shape, or form. And then we start testing vaccines in animals, seeing what the immune response is. So this isn't a new thing that people just made up, right? You study the organism so much, you understand the structure and function of the organism, and now you're developing a strategy for the immune system to recognize it and prevent it from binding to your cell so your immune system doesn't get activated. One of the misnomers, one of the things that we always said, and I talked to Fauci about this, one of the things we always said was you always say like, vaccines prevent infection. No, vaccines prevent disease. They prevent your immune system's response to the presence of a virus, right? Or the presence of a bacteria. Let me give you an analogy. We all have friends, and our friends, most of them, probably have a car and they have a vehicle. And they come to your house and say they've been driving a Honda Civic for 10 years. They come to your house all the time. You see the Honda Civic, it pulls up. You're like, oh, it's Claire. She's coming out of the car. Okay, cool. Hey, Claire, how's it going? Whatever. Comes in your house, you have a drink, whatever. One day, Claire gets a new car. She gets an all black Range Rover. She drives over to your house. Claire's still in the car driving, but you don't know it's Claire. Claire pulls up in your driveway. You're anxious. You're getting a little excited, like, well, what do I need to do? Right? Oh my God, what's going on? That's what the immune system is doing when it sees a virus that has a different protein. It's still influenza, but the protein changed a little bit. So the car that it's in just changed, right? And then all of a sudden, Claire gets out of the car, you're like, oh, it's Claire, right? And then all of a sudden, the immune system's like, oh, it's the flu, but it's already overreacted. So what a vaccine is doing is it's just telling you what kind of car Claire is in. So the vaccine's like, hey, flu's driving a Range Rover this year. Oh, okay, cool. Right, that's how vaccines work. And so it's not like it's like this magic thing and we're, putting a chip in or anything like that. This is just science, right? This is how they work. And like, for me, like I always wanted to empower my patients with knowledge and just teach them and let them make their own decision. Like, this is what the organism looks like. This is what the vaccine consists of. This is how the mechanism of vaccination works. Here's some papers to support it. Do whatever you want to do with that information, but I know I've done my job.
Right.
And it sounds like that's what you're doing. You're the first public health officer, and I've talked to a lot of them, that has told me they went door to door. Like door to door.
Our team did.
Your team did.
Yes.
Oh, yes, your team, whether or not it was you or not, doesn't matter. But like the fact that you have boots on ground and you're going door to door, right? I remember when I was a kid, my parents are very involved politically in California. So like I grew up with Willie Brown. He was like my uncle, right? And when Willie Brown ran for mayor of San Francisco, my mom, the first time, my mom was like, all right, Jamie, you got to come. We're going to go to the German neighborhood. We're going to go campaign for Willie Brown. And we went door to door. And I was like, man, this is for the birds. Like, what am I doing this for? I'm like 12 years old or whatever. I'm like, what is going on here? But like, what I learned in that process was like, the person is very open. The person wants to communicate. The person wants to talk to you. And just by knocking on that door and talking about the candidate, educating the person about the candidate a little bit, it just kind of opened my eyes to this communication that needed to take place. And like, I feel like when you said you went door to door with vaccine education, it just brought me back to that. And I was just like, oh my God, like that is what we need. Everybody's always talking about, oh, how do we do this on social media? How do we do this online? No, like it's door to door.
It's those real human connections.
Yes, exactly.
Yeah, absolutely. Because social media can be generic, but when you have somebody in front of you, especially a public health official who has a vast amount of education, and you're able to connect with that person, it's more valuable, in my opinion. I think that's what you were speaking on.
You know, one of the things I said to people who look like me, right, to Black people, is I said, like, you guys know that the person who brought the concept of vaccination to this country was an African slave, right? And the story, it's the story of Wanzimus, right? And it was during smallpox. And Wanzimus was a slave of one of the guys who was involved. And he was like, hey, bro, like in Africa, what we did was we popped a little pustule and we put that in cuts on people. And what we noticed is, yeah, some people, they died, but most people lived and they did fine. And the guy was like, wait, what? You did what? And that's where the concept of exposure, a small exposure to an organism, led to, you know, the immune system being able to recognize the virus and be able to handle the presence of it very organized, right? And so that way the people didn't die. And so that's what they did. Then they started inoculating folks, and they noticed, oh my God, the folks that we inoculated with the pustule, less people died than would have died of smallpox. In the 1800s, there were two people kind of battling for the prominent scientific role in like France. It was like Louis Pasteur, who is like the godfather of germ theory, and Antoine Béchamp. They were both very smart scientists. Louis Pasteur said, hey, listen, man, there's these organisms, these microorganisms, bacteria. They're the things that are causing disease in human beings. And Béchamp said, oh, no, hell no, bro. Like, you're wrong. It's all about like your blood and your balance and your fluid. And if your balance is off, then those organisms can live, right? And so those were the two camps, right, in the 1800s. And then obviously Louis Pasteur's camp. And once we had, you know, once we discovered, you know, the electron microscope and could actually see the organisms and see the inflammatory response, we're like, oh yeah, okay, Pasteur was right. So that's how we treat medicine, right? But if you're a Béchamp fan, you don't believe in germ theory. And so turns out the Secretary of HHS is a Béchamp fan, and that's what he's written about many, many times. And that's why he has this propensity to be against vaccination in general. But whatever, that's besides the point. But I think individuals need to understand that these concepts have been studied historically. We've looked into this. None of this is new. It's not made up. Now it's time for What's the Buzz, presented by BuzzRx. Every week, I answer a health-related question from one of our viewers. Dr. Rutland, is it safe to get multiple vaccines at the same time, like the flu and COVID shots? Well, here's the thing. Actually, flu and COVID vaccinations have been studied together. And what it shows is that the efficacy of both vaccinations when given at the same time is really no different than if they were given alone. But here's my advice to everyone. I'm a one vaccine at a time guy, so I like to give one antigen to allow my immune system to recognize one antigen at one time. That's just me. Then I wait 7 to 10 days for the next time. That's the buzz. If you have a question, email us at healthexchangepodcast@gmail.com. Thanks again to BuzzRx. Look up your medications on buzzrx.com or the app to see how much you can save.
I just wanted to follow up with what you were saying about the measles vaccine and giving information and then letting folks make their choice, which I think is very, very important. I think one of the differences in public health is the choice that you make. What impact is that having on the rest of the community? And as a public health official, like, I'm actually responsible for everybody. So some folks that have gotten measles is because they're too young to be vaccinated. So they're like 11 months old, they're in a health clinic, you know, somebody with measles comes in and then infects that person. And so that's another part of public health that we have to, you know, navigate, which is still a lot of relationships and communications and what have you. But it can be really tough to say, like, yes, this is your choice, but, you know, are we going to have to limit where you're able to go because somebody else could become infected who can't? Either they're immunosuppressed, they're too young, or have, you know, an allergy to something, and they're not able to be vaccinated. Yeah.
Wow. So that's like part of your job. You got to narrow down who is infected, why they're infected, And then sometimes you got to give bad news like, hey, you can't go to, 2nd Street in Long Beach because like you about to infect everybody. Like we can't have.
Yeah, that's actually a big part of my job. It's called quarantine and
Yeah.
isolation. So if you're somebody who's been exposed, you have to, we have to say like, are you immunized to measles? You have to prove it. And if not, you have to stay in your house, and it can be up to 21 days where you're not able to work, school, what have you.
And if they leave their house, what happens? They get arrested?
Well, we try not to do that. But you are defying an order.
Sure.
And so, we try to work with you. Like we try to, what's the issue, and try to, again, that's where like, oh, you don't have food. We try to give food, try to help you out, sign disability paperwork so that you can, do that. The important thing is that we are stressing the importance of not being out infecting other people just because, measles in particular is so contagious.
Yeah, so the childhood vaccination schedule is appropriate because of the vaccine preventable illnesses. You got your kids vaccinated, right?
Definitely.
Yeah, me too. It's interesting how, and I get it, everybody has their choice, but it's interesting how people are making choices not to get their children vaccinated. And you got, I don't know, 176 kids in Texas that are sick. A couple of them have died because they didn't want to get vaccinated. And it is just like...
And oftentimes it's off of a hunch and not scientifically. We have all this data that supports vaccinations, but, and it is a sensitive subject. We have to kind of tiptoe around, but there are people who choose not to vaccinate based off of hearsay or fear. And it's to be respected. People are entitled to how they feel, but I feel like we need to focus on the data and evaluate that. And that speaks volumes. The scientific process, as you spoke about, speaks volumes. And that's personally how I made my decision to vaccinate my children.
I do think it's really important to use, accurate sources of information.
Absolutely.
And, looking at places like the American Academy of Pediatrics, the World Health Organization, the CDC, for accurate information in order to make a good choice. That's what you want, to be able to make a good choice. And so I do think that is really important. And one of our, biggest jobs is to make sure that we are getting that information out there in a variety of ways.
And I think that people, parents, I know I've taken this before when I've been in the setting, when my kids are 16, 15, and 8, but when they were of age for vaccination, I would oftentimes ask the physician, I'd say, well, what would you suggest? What would you do? Because I trust in their scientific process. I trust in their education, their knowledge. And then as a nurse practitioner, a family nurse practitioner, I've been asked that question as well. Patients have said, what would you suggest? What would you do? And I always reflect back to the research. And, I appreciate your role in that, because without people like you in the position that you're in, we wouldn't have access to a lot of this data.
And I think it's also important not to make a bunch of assumptions. There's a lot of things like, Black people don't get vaccinated or other assumptions. And I think, no community is a monolith. And so I think it's really important to really delve into and know, like, what is your reason? Is it
Absolutely.
that, like, somebody is telling you this, a trusted family member?
Yeah.
We're not sitting here saying like there's no side effects
Yeah.
to vaccination. We're not saying that. You're going to have an effect of vaccination. I think you asked me earlier, you're like, I can't remember what your words were, but you were like, man, I got vaccine and my arm hurt, or I got, I had a little fever. And I'm like, you're supposed to. Like, you're activating the inflammatory response. Like, that's what we want to happen, right? We need you to have some kind of reaction. Like, there's literature to support elderly individuals, so individuals who are over the age of 65. Elderly individuals that get sick that can't have a fever, those individuals do worse than individuals that can. Nurses will always call me and say, oh, Mrs. Smith has a fever to 102.6. And I'd be like, okay.
Yeah.
But do you want Tylenol? I'd be like, no. Yeah, if she's 105 degrees and she's having a seizure, different story. But 102.6? Yeah, okay.
Yeah, I deal with that a lot when I've worked in urgent care settings, and patients, family would come in and they're like, oh, their fever was 101, or, their fever. How are they acting? Well, they were playing, they were running around, they were eating. I'm like, perfect. let the fever ride out. Your body is doing what it's supposed to do.
And I think where immunization can step in for that is that the fever that you're getting from the immunization is nothing compared to all of the different symptoms and complications that you would get from actually having the disease. So actually having measles can lead to blindness, death,
Yeah,
brain inflammation, pneumonia.
sure.
Whereas the vaccine, you might have a sore arm and then like very rare, side effects. And so I think when we're weighing the risks and benefits, the overwhelming majority of the information is towards vaccines being a very safe and effective way of preventing this illness.
I don't want to blame the pandemic and everybody's, fear of mRNA vaccinations, but I always go back to, man, like, maybe we didn't do the best job of explaining what vaccinations were, how they worked, and so people could understand like what it is we were trying to accomplish. I mean, and for me, the thing that upsets me the most is like, you've got parents who are intelligent and mature and feel like they're making the best decision for their kid who's helpless because they just do what their parent, they don't know any better, and they die. Right? Because their parents didn't get them vaccinated. Now, again, the parent probably feels awful, right? But like, it's just for me, it's like we need to have these discussions more. We need to disseminate this type of information more.
It's about all of us, parents, schools, faith-based organizations, because the vast majority of people get their kids vaccinated. And so in order to have a healthy community, we all need to be promoting those positive vaccination messages. Because if you keep hearing something, even if all it has to do is just plant a seed of doubt.
Sure.
And then that can kind of influence your decision making, and so fear and emotions are a very powerful incentive. And so I think it is important for everyone, because everyone is involved. Like, everyone could be in an airport, you could be at a school, to say, yes, we agree with this, we support it, we support the science, in order to counteract the balance of the messaging, which I think sometimes can go in a certain way.
One statement, one question. The statement is, I have never seen an individual in the intensive care unit or in the hospital that got a vaccine and got significantly injured. Never seen them in shock. Never seen them overwhelmingly sick. I would see it. Trust me. I spent a lot of time in ICU.
Yeah.
Like, this.
Yeah.
Like, trust me, I would see it. Right? Maybe one person, and this person had an autoimmune disease to begin with. But maybe that. I talk a lot about health disparities. I talk a lot about hesitancy with medicine. And I always go back, with individuals that look like me and my grandparents. I always think about Tuskegee. I always think about radiation trials, all of that. As much as I know about that, and as much as I can say, well, maybe that's why, I got to be honest, I've never had a Black family in my office say that they don't want a vaccine because of Tuskegee ever in my life. I've never had that. I get it, but I've never. And I'm just going to ask you: have you ever had that?
No, and I feel like what Tuskegee did was it illustrated a larger issue, and that is the relationship between Black people, African Americans, and the healthcare and public health system. That experiment was done by the United States public health system, where they let Black people be infected with syphilis when we had treatment, and they did not give it to them. And they studied them to see what would happen. So you could just say like that, oh, this one thing happened, which was egregious,
horrible.
right? And that would just change generations worth of people's ideas about interacting with the healthcare system. When you really look at it though, like that's just a signpost of what the relationship was, right? So there is a very long history. I think the same history of vaccination, there's a very long history of Black people being mistreated by the medical system and by the public health system. And I think, so you don't have to have like an actual thing. It just gets bred. Like I can count on one hand the times that I went to the doctor growing up. And I never knew why. And I still don't know why. My parents are both deceased. You know, I know I got vaccinated. And then after that, like, one hand, I cannot remember ever, ever, ever. Who knows? You know, was it because you don't mess around with them? You know,
Yeah.
you do your own
Yeah.
thing. You stay in the community. You take
Mhm.
some herbs. You go to so and so. You drink the tea. You do, because we know if we go over there,
Mhm.
you know, what are they going to address us as? Are they even going to let us in the front door? Are they going to even see us at all? Are they going to do an experiment? You know, there was a lot of gynecological experiments. A lot of the things that we have now, the advances that we have in gynecological care and the actual gynecological exam were done on enslaved women without anesthesia. So you don't have to know the exact experiment or the exact thing to know that this isn't a safe place for you.
Right.
And I feel like we need to heal that relationship. That relationship is being damaged right now,
Mhm.
right? Harm right now. And so in order, like, why would I listen to you? Do you have my back? Do you have my best interests? You know, and it's also not healthcare. You're curating where I live. You're curating my job opportunities. You know, you wouldn't let me like sit on the bus. You don't let me drink out of the water fountain. You know what? How many times? You know, you're spraying me with hoses. You got knees on my neck. So, like, how much of that has to happen before you're just kind of like, okay, got
Sure.
that lesson.
Sure.
So, I think we need to really heal that relationship.
You know, it's interesting. I agree with you, but I will say when I was growing up, my grandfather, who was in logistics in the Air Force, who was number 3 in command at McClellan Air Force Base or something, but word on the street is he was a spy or something. I don't know. Who cares? He was wherever the action was during his lifespan. But my grandfather used to say to me all the time. He would say this to me at least once a week. It was a very interesting statement. He would say to me, "Boy," and I said, "Yes." He would say, "I want you to know this." I said, "What?" He's like, "It's never because you're black." He wanted me to know this. And said this to me every single week, right? And even though he knew that it probably was, he also knew that I could not have that attitude
Hmm.
growing up. Because if I did, it would prevent me from getting somewhere,
Right.
from elevating to wherever he wanted me to be. And God rest his soul, I hope he's happy. But it's just, it's one of those things that as a minority, like, you're just fighting against, like, it's just natural. Sometimes I'll have friends that say, man, I'm more black than you. And I'm like, what are we talking about? Like, really? Like, is that really what we're talking about? Like, you know, it's such a interesting battle to go through in general. And then in the healthcare, I see it because I remember this one gentleman and I would take care of him. He'd have asthma exacerbation like every couple of weeks when I was in Kansas City, black guy. And he was about 43 years old. I remember him because I remember his last name was Finley. God rest his soul. But I would take care of him. I'd give him his prednisone every couple weeks. Every couple weeks, I would take care of him, blah, blah, blah. And this is when I was moonlighting as a fellow. And then I leave. I'm the only black hospitalist on that team. And every time he got admitted, I would always get him, right? Which is fine. Like, I didn't mind because I knew I took care of him, whatever. Soon as I leave, not a month later, comes in again, he's dead of an asthma exacerbation. And I have to ask myself, if I was there, would that have happened, right? And I swear the answer is no way in hell. If I stayed there, if I was still practicing there, there's no way. Like, he would have been on appropriate there, all that stuff. I was just a hospitalist, right? And he couldn't come to KU where I trained because he didn't have that insurance. He had to go through the other system, but he never made it and all that. But you have to think about these things. And like, every time we develop educational tools or educational slide decks on disparities, we always say there's a disparity, but we never, ever publish a solution. It's always, this gap exists, this gap exists, this gap exists. And it's never solution oriented or solution based. Like, I just think about my mom. She worked 9 to 5, went to law school from 5 to 10. She couldn't go to the doctor. Like, you know, and then she would work her job for government and then she would go to her law office, right? Like, she couldn't get there, right? And doctor's offices aren't open on Saturday and Sunday. And my mama was working. Like, and so like for me, it's like solution seems simple to me. Go have a clinic on Saturday and Sunday over the weekend, around the corner here in Compton, or over like it seems really simple to me, but those solutions aren't ever completely
Hmm.
offered. Just sitting in between two black people. I know it's hard right now.
No, it's not hard. Actually, I'm a Mexican American man, so I feel like I'm with, ethnic
Your homies.
ethnic folks, No, but I think I think this is a good time for me to highlight me watching you as an African American physician, because as an ICU nurse, I was able to see various different providers, okay? And if there was an African American family that I was caring for and Dr. Rutland walked in the room, it was almost a sigh of relief. And that trust was immediately bridged. And they felt important, they felt seen, they felt heard. And it was great to watch that. So I think it's really good that we have people in positions that are of different backgrounds, African American, Chinese American, Mexican Americans. When I speak Spanish to patients, they immediately feel seen, heard. So I think it was a good, thing to bring up and talk about.
Yeah, I'm telling you right now, I love Mexican patients. They were so nice. They were so appreciative. I mean, honestly, like seriously.
No, very, very
like
good.
if there's one thing I've missed about practicing in Riverside is that. It's like the appreciation. A lot different practicing anywhere than practicing in Riverside. Like it's just a lot different.
Yeah.
Is it?
I think one of the important things to do is to just get through quick questions, quick responses. So we're going to ask a bunch of questions. We're going to fire them. Just quick responses. So first question, was there really a vaccine made from cowpox that saved the world?
Yes. So the smallpox vaccine started from cowpox. Jenner, one person in London, discovered that milkmaids did not get smallpox. And so he hypothesized that it was because they were getting infected with cowpox. And so he tested that hypothesis by injecting some of the cowpox material into a little 8-year-old boy and then subjecting him to smallpox numerous times, different levels, and he never got sick. And so, yes, that was how the smallpox vaccine started. And it has advanced from there because science keeps advancing and we keep studying. And so now we use another type of pox virus that's very similar, but also much safer in an injection.
Can you name the first 3 vaccines given to most infants in the United States?
So you start with hepatitis B, you should get at birth. And that is because, so one of the reasons the schedule depends on your age and when you're at highest risk for getting a certain disease and when your immune system is most primed or ready to have the vaccine. And so for Hep B, you can get it from your mom during delivery. And so giving the baby the first Hep B vaccine can actually help protect that baby if he or she was exposed to the hepatitis virus while they were being delivered. And then other common vaccine would be the diphtheria, tetanus, and polio vaccine. You also start that at 2 months of age.
What percentage of the population needs to be vaccinated for herd immunity? And I guess, what is herd immunity?
Yeah, so that's one of the things we're thinking about it more as community immunity or network immunity. And that is the level of folks who need to be immune to a disease for it to stop spreading. We'd like that to be from vaccination because that means that you didn't actually get sick. And the level that you need depends on what disease it is. So for measles, we talked about it needs to be about 95% of the population needs to be immune. For other diseases, it might be a little bit less because they're not spread as easily.
So we're changing the verbiage from herd immunity to community immunity. I like that. That's
that makes
interesting.
sense.
It
Doesn't that
does.
make
It does.
sense?
Yeah.
And they're like, what's a herd? What are you talking about?
Don't call me a herd, please.
Right, exactly.
I'm a farm animal.
And I think it emphasizes the importance of the community.
Absolutely.
That, you're doing this for yourself, your family, your community.
Myth or fact, vaccines overload the immune system because children receive too many shots.
So we kids are being exposed to what we call antigens. You had mentioned that before. Those are those little proteins that can kind of get in your body and that your body's kind of, looking around, tracking, monitoring, and to make sure that our immune system is ready if that ends up being a problem and we need to neutralize it. And so as we're walking and crawling and eating and being in the world, we have tons and tons and tons of antigens that we're either inhaling or eating or being absorbed through the skin. So the vaccines that we're using to prevent all of the diseases that occur are small, minute number of antigens when you compare it to the vast majority of antigens that we're coming into contact with as we walk around and crawl and what have you. So we are getting just a very small amount. We're getting just what we need in order to fight off these illnesses.
I do want to explain this concept real quick. You guys have probably heard of the term adjuvant. So sometimes vaccines will be combined with what's called an adjuvant. All an adjuvant is a molecule that stimulates the immune system. So if we're talking about, let's say, the shingles vaccine, right? There's an adjuvant that's called ASO4, I believe. And so what that adjuvant consists of, one piece of it is actually called QS21. It's from like tree bark, and it stimulates a certain component of the immune system. Another piece of it is like a lipopolysaccharide, and it stimulates another component of the immune system. So one stimulates the innate component, which is the acute activation of like neutrophils or macrophages to recognize the antigen. These are white blood cells that recognize things quickly. And then you have another component that stimulates T cells to be able to make not only T cells that can recognize pieces of a virus, but also make B cells to make plasma cells to make antibodies that recognize pieces of a virus. So, you'll hear a lot of people talk about, adjuvants causing things, or hear mercury or whatever. Like, first of all, you got to see if mercury is actually a component of the vaccine that they're talking about, because almost 100% of the time it's not. But the other thing is really to understand how those actual adjuvants work and what they're stimulating, because sometimes vaccines need the adjuvant because you have to stimulate the immune system appropriately. You can't just inject something and hope that the immune system responds. Sometimes the immune system doesn't care, right? But you want to make it care, and that's why you use an adjuvant. Which vaccine-related ingredient has caused the most myths?
One ingredient that has caused a lot of myths is thimerosal, which is mercury. And it was used a very small amount to help preserve the vaccines. And the type of mercury that was used was not the type that causes the damage that you get in your body. It just stays. It helps the vaccine be safe, and then it just kind of dissolves. However, we have not used thimerosal in vaccines since 2001.
So, in other words, what I said earlier was correct. It's not there.
It's not there. It is not there.
All right, let's play a game. We're going to call it What Would Dr. Davis Do?
My sister refuses to vaccinate her kids, and our parents are worried about hosting holiday dinner. Do I speak up or stay quiet?
I feel like in this scenario that I would speak up. You are a part of the family unit, and I think that addressing concerns and expressing concerns is important. And maybe there's some workarounds that can happen. Doing things outside tends to be safer than doing things inside. Limiting your amount of exposure, wearing a mask. So these are things that could help decrease the level of transmission. So I definitely would bring it up.
This is one that we talked about earlier, but it's a great one, probably a really popular one. So I'm a new mom, and my pediatrician is recommending vaccinations, but I have friends who are warning against it. What do I do, Dr. Davis?
So I think it's important to have really open and honest conversations with your healthcare provider. That person is there specifically to keep you and your family healthy, to keep your kids healthy. And so I would just, address your concerns, say what it was that your family member said, and go over it, and then make the best decision based on this accurate information that your healthcare provider should be giving you.
I don't know about your kid's school, but my kid's school has a vaccine mandate.
Don't play.
But a parent group is trying to get overturned, child. Should I get involved?
Yes, you are a part of that community. Your kids go to that school. You go to that, you go to events at that school. And so I do think it's important to raise your voice around what the community is going to look like at your school.
So I'm at the pharmacy. and I overhear somebody trying to discourage somebody else from getting the annual flu vaccination. Do I say something or do I just kind of keep to myself? What would Dr. Davis do?
So
Yeah, would you say something?
I don't think I would, I
Okay.
don't. So I think there's a lot of factors with this one. So I think there's where are you? Like, who are everybody? Like, what's the situation? Because you can really start,
Yeah.
Yeah, it's a
Um,
mess.
yeah, and I don't know how much influence, like, just some random person saying something. I don't know.
I don't know if you're a random person though, Dr. Davis.
Well, in this
You
scenario,
might have to throw down some credentials at
I
that point.
mean, flu is one thing. At least there's like therapy for flu outside of vaccination, right? That's why the flu vaccine in general, at least this past year, was 42% efficacious. The year before, it was like 18% or something like
Mhm.
that. So, like, influenza, like, I trip about it, but like, I'm not going to scream and yell about it, right? Now, if somebody was like, if they had said they were talking about the measles vaccine that way or something like that, then I would.
A little different story.
That's a little different story.
Yeah,
But
yeah.
influenza, I'm like, okay, just go take some Tamiflu or some Baloxavir or something. Like, it's fine. Like, whatever.
Yeah. I still think, like, flu vaccine, I think I still feel really strongly because I do think it keeps people out of
It
the hospital. You
does.
know
It
that.
does. Yeah, yeah.
And keeps people from dying. And
And yeah,
I've seen
they're
people intubated
yeah,
from the flu.
absolutely.
But I know what you're saying. And I think 18 or 42% effective is still helping you stay out of the
Yes.
hospital. And I will say, for me, I skipped a flu shot one year. I was a resident. I was busy. I was just running around, whatever.
Yeah.
I'm like, ah. And man,
You got hit with it.
oh,
I
Oh, wow.
skipped it in fourth year, and match day, I got the flu. I could not go out. I was like, yay!
it does. It feels so bad. So I
Yes.
never felt, So that's what got me. I'm like, I'm doing this.
And there's a mortality rate associated with influenza.
Mhm.
Every year we have people that die from
Yeah.
influenza and simply because they weren't vaccinated. I don't want to be one of those statistics, and nor do I want anyone in my family being one of those statistics. So
Right.
we get it every year. Absolutely.
Yeah.
mRNA vaccines got a bad rap.
hmm
They did. Like, they're effective. They work. mRNA technology is going to lead to treatment of a lot of different diseases besides just vaccine preventable diseases.
Right.
We know that technology is here to stay. But the possibility of universal flu or pan coronavirus vaccines, what do you think about that?
I think it's wonderful. I think anything that makes things easier is a plus for vaccination, right? I think that's one of the biggest barriers. Like, if we're saying that this is so important, it should be free and it should be easy to get. And so I think having a pan flu or a COVID combo would be a great advance for us.
I mean, I think, what we're looking for, everyone, is we're looking for a protein within a virus or a bacteria that's heavily conserved, meaning that it can't mutate.
Mm-hmm.
Because if it mutates at all, then the shape of it can even change. And the function, maybe it won't change, but the shape can change so the antibody can't fit in the pocket. The T cell receptor can't recognize it as well. And so, when we're talking about pan coronaviruses or universal flu, we're talking about finding a common protein that's present in all of them that the immune system can recognize quickly. So that way it prevents infection, which is going to prevent that response of the immune system. So that's what we're talking about. And to do that, I mean, it takes a lot of effort. So everybody's trying to find that. But if you ever ask the question of like, why I got to get this flu vaccine every year, or why I got to get a coronavirus vaccine every year, it's because they change their clothes every year, right? They mutate every year, and the immune system can get duped. And we don't want our immune system to get duped. We want our immune system to be prepared.
So, Dr. Davis, I don't know if you know it, but I speak Gen Z fluently. I have 2 Gen Z kids, and so no cap.
Yeah, there you go.
Yeah.
But how would you cater to that demographic? I know Gen Z, they are our newest upcoming generation, and they're going to be the future of healthcare and the future population. How would we cater to them? Will we use Gen Z lingo? Are you okay with that?
If it's authentic,
Yeah.
yes.
Okay.
So I think for Gen Z, they are looking at things from a very holistic point of view,
hmm
and they are using a lot of social media. They get a lot of their information on social media,
Yeah.
and they want convenient access to things. So they have grown up with Amazon and, Spotify and what have you.
Mm-hmm.
And so they're used to, you push some things and stuff happens. I take my son to the DMV and he just about dies when he has to wait for 2 hours for something. And so I think that will be important for the next generations, having really good information that isn't lasting forever, and trusted messengers. And then when they make their decision, and holistic, they look at everything. They're very mental health aware.
Mm-hmm.
And so making sure that you're fitting vaccines into this is how you are, healthy in general,
Mm-hmm.
and allows you to go out where you want to go out and play what you want to play and go to school and all those good things. And making sure that we're using trusted messengers.
Got it.
Yeah.
Would you be open to me giving you a Gen Z verbiage quiz?
Sure.
Yeah.
Let's do it.
How old is your son?
I have a 21-year-old and an 18-year-old.
All right. You should be. Okay. So if I was to say, Dr. Davis, no cap, what does that mean?
Yeah, no lie.
There we go. No, there we go. And you can jump in on this too, because I know you may be a little further out of Gen Z than I am, but that's okay. And that's neither here nor there. So what if I said, Dr. Rutland is the Rizzler? What does that mean?
I mean, what I mean.
Exactly.
Maybe
Yeah, he's got a lot of swag to him. He's risen it up.
Listen, Dr. Davis, do you have any call to action you want for the healthcare professionals in Long Beach?
We all need to be aware of vaccine preventable illnesses and diseases, and we need to make sure that we're having open and honest conversations with our patients. I would call our whole entire community to action around speaking up for what you want your organizations, your churches, your schools, your businesses to look like, and how you want to mitigate transmission of infectious diseases. We all want our communities to be healthy, and so I feel like this is a really important way for our communities to stay healthy and to be active.
Educating the public is how we're going to rebuild our trust in the community. And Dr. Davis' team is going door to door to educate you. So answer the door. Pay attention. We really appreciate it. Dr. Davis, really appreciate you being here today. Thank you so much to your team for allowing you to be here today.
Yeah, thank
Chris,
you for having us.
Always a pleasure.
Always a pleasure.
Thank you so much. Dr. Davis, where can people find you and where can people go for reliable health information, not only in Long Beach, but in general?
So we have a website that's longbeach.gov/health,
Mm-hmm.
and our socials are Long Beach Health DEPT. So
LB Health DEPT.
Yes.
Perfect. Chris,
Yes, sir.
where can we find you?
You can find me on Instagram or TikTok. It's Chris without an H. So CRIS_the_NP.
You guys know where to find us. We're at the Health Exchange Podcast on Instagram and TikTok. Get us wherever you get your podcasts. You'll see us every Thursday at 6 a.m. Pacific time, 9 a.m. Eastern time. Appreciate you guys listening, coming by. Thanks a lot to the teams today for allowing these two individuals to join us on set. Thank you so much for joining. Take care.